This is LiveWell Talk on new Clinician Spotlight. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Today's episode is another installment in a series on the podcast where we sit down with new clinicians at UnityPoint Health, Cedar Rapids, and get to know them, not only as a clinician, but as a person. Our guest on today's episode is Melissa Janssen, genetics nurse practitioner with Genetics and Cancer Risk Assessment Clinic at Nassif Community Cancer Center. Melissa, welcome to the podcast.
Thanks for having me.
Well, it's a pleasure to have you. Tell us a little bit about yourself. Where are you from?
I grew up in Maquoketa.
Maquoketa, okay.
Yes. So spend a lot of time exploring the caves. Now I get to take my kids back there. My husband and I have 4 kids. Bo is 8, Brenna is 5, and the twins, Brock and Brenna, are 3. So we get to go back and spend a lot of quality time at the caves. We're also busy.
So 4 with a set of twins.
Yes.
Wow.
Yes.
Yeah. And they're all pretty close in age there, really.
They are,
yeah,
yes.
Crammed in there.
Wow. Keeps us busy, out of trouble.
Yes. Yeah. Well, yeah. And you will be for a while, it sounds like, too. And having 2 daughters, I'll just tell you, they're never off the payroll. So I don't.
I'm starting to see they get a lot of my
be prepared.
Attitude, right?
Yes, be prepared. So where'd you train at?
So I did my undergrad at Mount Mercy here in Cedar Rapids, and then I did my master's program at the University of Illinois, Chicago. So I did a lot of my clinicals, my preceptorships, kind of around wherever they assigned us to. So that was a nice advantage of that program. And we didn't have to find
Chicago
and Quad Cities area. So we had the advantage of Iowa and Illinois. So we had a lot of preceptors to choose from, which unfortunately I think is becoming harder and harder for students, not only from PA programs, NP programs, just that surplus of finding willing people to take you on as a student. So it was a nice advantage to have that in their program.
We just, clinicians just don't have the time like they used to.
It's a big commitment.
Yeah.
And so at the time, I didn't see the advantage of them setting that up for us. But now on the other side of it, it's a huge advantage to programs like that.
Well, and just remember as you get into practice to return that favor. That's what I always counsel people on.
And that's one of the advantages of having gone to Mount Mercy. I still have contacts with some of those faculty members. And so I've been able to go back and lecture and have had some students now with their master's program come back. And so it is nice to be able to maintain those connections and pay it forward because it really is true.
Mount
Full
Mercy
circle.
St. Ambrose merger, that'll be interesting how that unfolds.
I was just talking with one of the preceptor faculty members there, and they're really excited about that partnership. So I'm excited to see what that brings for the future.
I am too, not only just Catholic institutions, of course, support that, but Mount Mercy's been real forward thinking in the last 20 years, and so I think this would be a good move. Mount Mercy has an excellent nursing program.
Yes,
and that's coming from a co-college alum, but Mount Mercy, great nursing program that we've benefited a long time here at St. Luke's, and we're very pleased with.
Yes, absolutely.
Well, coming out as a nurse practitioner, you had all these fields to choose from, quite a wide path that you could have really specialized in just about anything in this day and age. And why did you choose genetics? How'd you end up here? I
think genetics probably chose me, truthfully. It wasn't something that I chose coming out of it. I have had a background in pediatrics ICU, then I did diabetes education, I did pain management, and most recently before this job, I was working in ENT. So it wasn't something that was straightforward. And I think a lot of times in life and in nursing too, you get a varied path to find what's the right thing. And through a variety of experiences and through a personal cancer diagnosis, I got to see the services that the Nassif Community Cancer Center offered. And the staff there was wonderful. And I think it was a really organic opportunity that presented itself that felt like it would be a great fit for me to offer a unique opportunity, not only having seen the patient side of things, but then also as the provider side of things, that I really feel I could offer a very empathetic approach to how I can serve my patients. So I think that's probably what's been the biggest draw for me in my current role. And as nursing, that's the beauty of it. If we see an opportunity where we can provide our services, then we can really shine in that. So
you can find out what really motivates you. Would you
Absolutely.
find your
when you find where your calling is, then you can take that calling and you can really take that path and serve it. And I feel like that's where my call was at this time. And it's been a wonderful opportunity. And I hope that the patients that I've been able to see so far have benefited and have found that same service has been beneficial for them too.
Yeah, I think once you discover your why, we all have our individual whys. They're all different.
Yes.
And once you discover that, it is just such a sense of inner joy that it's just difficult to explain.
And I think anyone in medicine or healthcare would say the same thing too, because there are days where medicine doesn't look appealing, and anything looks better.
Right. No, but once you understand your why,
absolutely,
why you do it, and everyone's why is different. Everyone's why is personal. But once you get that, it's just joyous.
It's so fulfilling.
It's so hard to explain.
Yes.
And I feel because I have colleagues that haven't found their why yet, and they're as far in their career as I am.
Mm-hmm.
And doesn't mean they don't like their job. They like the people they work with, and they're very good at it. But once you find out why, it's the world is different. I can't explain it.
And I think the patients see it differently for how you provide that
they
service
have to.
to them.
They have to.
Absolutely.
They have to. Absolutely.
Yes.
What do you do for fun?
Chase my kids.
Yeah, I was going to say you don't have any time.
No, we live on an acreage, so we garden. We like to be outdoors. We like to, go on the boat, kayak, things that really outdoor activities. We like to be busy. We don't sit still, whether it's with the kids or or just
you
anything. And
four of them, you won't be sitting still.
There's so much to do here, truly for recreational activities. So it's fun to take advantage of those.
Well, that's outstanding. Well, Melissa, thank you for joining me. It's fun to get to know you, and we're so glad that you're here with us. And we look forward to working with you on mutual patients and serving the Cancer Center. Once again, this is Melissa Janssen, genetics nurse practitioner with the Genetics and Cancer Risk Assessment Clinic at Nassif Community Cancer Center. If you're interested in scheduling a genetic consultation with Melissa, call the Nassif Community Cancer Center at 319-558-4876. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.